Welcome back, students. This is a short note on the maxillary air sinus. Those students who are from the dental faculty, for them this maxillary air sinus is very important because it is related to the upper teeth, that is maxillary teeth or teeth associated with the upper jaw. Okay, so the question is, describe the maxillary air sinus. You can begin the answer like this. The maxillary sinus is the largest air sinus of the body. It is located inside the body of the maxilla. So if you have read the maxillary bone, okay, then it will be easier for you to understand this maxillary air sinus. Okay. Now the feature of this sinus. Now since this sinus is located inside the maxilla, okay, it is pyramidal in shape. Okay, it has pyramidal. That means it has the 5 walls and an apex. It is pyramidal in shape, that has the 5 sides, okay, or walls, that is anterior, posterior, roof and the floor, and a base, that is the medial wall. Base is also the medial wall, and apex. So there are the 5 walls including anterior, posterior, roof, floor and base, and then there is an apex. Apex is directed laterally towards the zygomatic bone, and base is directed medially, that means towards the lateral wall of the nose. So this is also known as the medial wall. So the base is sometimes called as the medial wall. The height of the sinus is about 3 centimeters, as it is the largest air sinus, paranasal air sinus. Height is 3 centimeter, length is 3 centimeter, and width is also almost 2.5 centimeters. So these are the dimensions of the maxillary air sinus. Let us come to the walls and their relation. Okay, we will come to the walls and their relation. But before that, I will like to show you the bones which forms the maxillary air sinus and the neighboring bones or neighboring areas. Now this is the diagram which I have drawn for the maxillary air sinus. In the orange is the maxillary bone, okay, with the various process of the maxillary bone. Now this is the maxilla, and then inside this cavity is the maxillary air sinus. Above this cavity of the maxillary air sinus, it is separated by the orbital plate of maxilla by the orbit. This is the orbital cavity. Laterally it is the zygomatic bone. Superiorly the roof is frontal, and medially is the ethmoid bone, the air cells. Ethmoidal air sinus in this. Okay, here you can see this is the whole in yellow color is the ethmoid bone. You can see here just medial to the ethmoidal air sinuses, which forms the medial wall of the orbit. There are the 2 bony cells, that is the projection of bones coming from ethmoid is superior concha, and this is the middle concha. Now this is the perpendicular plate of ethmoid which forms the upper and posterior and superior part of the median nasal septum. Lower down, this is the vomer bone. So thus the vomer and perpendicular plate of ethmoid, these are the 2 bones which forms the median septum. So this is the nasal cavity, and if you go down here to this maxillary bone, attached is a separate bone which is the inferior nasal concha. So superior and middle nasal conchae, they are the part of the ethmoid, but the inferior nasal concha is a separate bone. So the floor of the nasal cavity is formed by this perpendicular plate, horizontal plate of this palatine bone. Okay, palatine process of maxilla. This is palatine process of the maxilla. This is alveolar process of the maxilla because it gives attachment to the teeth. This is the maxilla, body of the maxilla, and this is the opening of the maxillary sinus, okay, which is situated at a higher level than the floor. So the pus collected here in the floor of the maxillary air sinus is difficult to drain in the anti-gravity direction. I hope that you have understood the bones which forms the maxillary air sinus. So we now come to the walls and their relations of these walls. The anterior wall is formed by the anterior or facial surface of the maxilla. Anterior, which is not shown in this diagram. Anterior or facial surface. Let me see the diagram. If I can show you the anterior wall of the maxilla from the facial aspect. Yes. Now you can see this diagram, and here you can see this bone is the maxilla of right side and this is the maxilla of the left side, and this will form the anterior wall because deep to this is the maxillary air sinus. So this is the anterior wall of the maxilla which forms the facial skeleton. It forms the facial skeleton. Okay. Now the anterior wall gives passage to the anterior and middle superior alveolar nerve. Anterior and middle superior alveolar nerve, they pass through the anterior wall of the maxilla, which are branches from the maxillary nerve. They are branches from the, as it lies in the orbital, that is infraorbital groove or sulcus. The posterior wall is formed by the posterior surface of maxilla. And where is the posterior surface of maxilla? Which is forming the anterior wall of the infratemporal fossa. Let me show you this if I can get a diagram. So I will show you the posterior surface of the maxilla. Okay, difficult to show you here whatsoever diagram I have, but you can get some idea from this posterior surface. See, in this we are seeing the skull from the base. Okay, and this part, okay, let me show you with the pencil. This part of the maxilla, see, this is the posterior surface of the maxilla, which forms the anterior wall of this fossa called as the infratemporal fossa. So this is that posterior wall of the maxilla. It is situated close to that of the inferior orbital fissure, okay, below that inferior orbital fissure. So you can get an idea that this is the posterior, and here was the anterior surface we have already seen from facial side, okay, from the front side, and this is, so this is anterior wall and this is the posterior wall of the maxilla. Let us come to the, and in this posterior wall of the maxilla, which is related to the posteriorly to the pterygopalatine fossa. Above it is related to the pterygopalatine fossa, and below the same is related to that of the infratemporal fossa. No, there is no diagram where I can show you. So this is the posterior surface of the maxilla. Above it is related to a fissure, pterygomaxillary fissure, if you remember, which is facing towards the posterior surface, is facing and forming the anterior wall of the pterygopalatine fossa, and below this posterior surface is related to the infratemporal fossa. If you will remove this mandible in articulated skeleton, then you can see both pterygomaxillary fissure and the posterior surface of maxilla forming the anterior wall of the infratemporal fossa. Okay, this part, okay, I was talking pterygomaxillary fissure here and the infratemporal fossa. After removing the mandible will become much more clear. So this is the posterior wall of the fossa. Many branches of the posterior superior alveolar nerve. The posterior superior alveolar nerve, they will be passing through the posterior wall. That means you will see lot of foramina in the posterior wall of the maxilla, posterior surface of maxilla, and they are for the posterior superior alveolar nerve, which are coming from the maxillary nerve. Okay, they will pass through the wall. Okay, now we have seen the anterior wall and posterior wall. Let us come to the roof. Okay, this diagram will show you the roof. Roof is formed by, again, the orbital plate of this maxillary bone, and it is formed by the it is forming the floor of the orbit, but the roof of the maxillary. That means bone is common for the orbit and the maxillary. For one it is forming the floor, and for other it is forming the roof. So the maxillary air sinus roof is related to that of the orbit. Okay. Now, through this will pass through the infraorbital nerves and vessel. Okay, this maxillary nerve and artery will come through the infraorbital fissure from the pterygopalatine fossa, and then it will run in a groove called as the infraorbital groove, and then this groove is related in which lies the infraorbital nerves and vessels. Okay, so this Roof is related to infraorbital nerves and vessel. The floor, you can see the floor here just above the alveolar process. This is the alveolar process and you can see the floor here. The floor is narrow, okay, because here it is formed by the this alveolar process, okay. So it is narrow and formed by the alveolar process where the teeth of the upper jaw are attached, okay, teeth, and especially the root of the first and second molar and premolar can just point out through here, covered by the mucous membrane of maxillary air sinus. They may project into the floor, okay, they may project. So roots may be seen in the floor of this maxillary sinus, okay. So this is the floor, this is the roof. We have seen anterior wall and posterior wall. Let us see the base. Base are the medial wall, and medial wall is broad, which is surfaces medially, and this forms the base, okay. This forms the base, and it is forming the lateral wall of the nose. It is forming the lateral wall of the nose, and it has a large opening, that is the opening of the maxillary air sinus through the hiatus semilunaris, and this will also give attachment to the inferior concha in the nasal cavity, okay. So this is that base or the medial wall, base or the medial wall of the maxillary. So the apex will be just opposite to it here, okay. So this is the apex which is pointing towards that of the zygomatic bone, okay. So this is the apex and this is the base, roof and the floor. Anterior and posterior wall I have already told you, and the nerves and vessels which are in relation to these walls, okay, that I have seen. Let us come to the opening into the maxillary air sinus, okay. So we come into the opening. The maxillary air sinus opens laterally. Laterally means it is towards the medial wall or the base. So the maxillary sinus opens laterally or in the base or the medial wall, okay. And there is a presence of a large opening here in the hiatus semilunaris, that is in the posteriormost part of the hiatus semilunaris, between, I would say, posterior to the opening of the frontal air sinus and ethmoidal air sinus, okay. This is the most posterior opening in the hiatus semilunaris. So this is the large opening of the maxillary air sinus, okay, and this is present in the middle meatus in hiatus semilunaris. At the level, as the level of this hiatus semilunaris or this opening is much higher level, at much higher level in comparison to the floor. See the floor, narrow floor, it is at much lower level than the opening. That's why any collection of the pus, discharge, or that of the secretion which is collected in the maxillary air sinus is close to that of the floor, is close to the floor, okay. Why it is close? Because it is towards the gravity. Hence the drainage of this is not possible in the anti-gravity direction, and that is the reason why the maxillary air sinus is very common and difficult to treat. Difficult because the drainage of the pus is not that easy. Let's come to see the, I think I should show you one more diagram for the maxillary air sinus. If I can get it immediately, I will show you, which will show you a fairly good idea about the sinus, okay, and its relation with the neighboring structure. So this was the bone, and this is the median nasal septum, and this is the ethmoid bone, okay. Ethmoidal air cells are here, and this is the middle concha is seen. The superior concha is more posteriorly, so it has not come in this section, and this is the inferior concha. So because it is the medial wall of the maxillary air sinus, it is the roof, okay, and here it is the base of the maxillary air sinus. This is the apex. So apex is opposite to the base or the medial wall. This is the roof and this is the floor. The posterior wall is seen here. Anterior wall is formed by the on the face, okay, on the face. In cross section, which is covered by the mucous membrane, you can see that how complicated are these sinuses. That means ethmoidal air sinuses, okay. See this ethmoidal air sinuses. This is the middle nasal concha, this is the inferior nasal concha, this is the middle meatus, and this is the inferior meatus, median nasal septum formed by the vomer and the perpendicular plate of the ethmoid bone is there. Okay, and you have to concentrate on this. This is that the maxillary air sinus with its medial wall or base. This is the apex, this is the roof, and this is the floor. Okay, anterior and posterior wall naturally in this section are not seen. Okay, not seen. You can see here some of the structures which are passing in the roof, and this is the inferior or infraorbital nerve. This is the infraorbital nerve, the maxillary nerve continuum, which will open on the face through the infraorbital foramina. I hope that you have got. That means maxillary air sinus is above related to the orbital cavity separated by roof. Medially it is related to the nasal cavity. Supromedially it is related to the ethmoidal air sinus. Inferiorly it is related to the teeth which are attached here into the this alveolar process, and I said that root of some of the teeth may project inside the sinus, and then below it is related to the oral cavity, and this is the tongue is seen here. So this sinus relation you have understood, especially the dental student, they should understand this sinus, because this will be again and again will come in your practice. Okay, let's come to the arteries and the veins. Now the artery supplied is the infraorbital artery, which runs in the floor of the orbit, that is in the roof of the maxillary air sinus. Then it is also supplied by the greater palatine artery and the posterior superior alveolar artery, which comes through the posterior wall of the maxilla, where there are many pits, I mean to say foraminas are seen. If you will see a dry bone on posterior surface of maxilla, you will know that foramina are for artery as well as for the nerve, posterior alveolar artery and nerve. Now the veins drains to the infraorbital vein and to the greater palatine vein. Nerves, okay, what are the nerves of this maxillary air sinus? It is supplied by the infraorbital nerve, which is going in the roof, infraorbital nerve, and then the branches from superior alveolar nerve and branches from the greater palatine nerve. That will three different nerves: superior alveolar, the infraorbital, and the greater palatine nerve branches. They will supply the mucous membrane of the maxillary air sinus. The lymphatic drainage of this goes to the submandibular group of lymph node, okay, which is very close to the submandibular gland onto the medial side of the body of the mandible, okay. And lastly we come to that of the applied importance. Now the pain of the maxillary air sinus because of the sinusitis or the infection, as I said, is very common in maxillary air sinus, and this pain is also felt in the upper teeth, because the roots of this upper teeth, they are projecting inside the base of the inferior wall, okay, or this is here they are root are projecting here into the alveolar process, alveolar process. Through the alveolar process the roots may come out here, and then they are projecting here, okay, they are projecting, okay. So the mucous membrane here will give the collection of the pus will be towards that of the floor here, which is formed by the alveolar process here, and is a narrow here where the root of the teeth are projecting, and this pus or the discharge or that of any secretion which fluid collected here cannot be drained easily by the maxillary opening, because it is located at the higher level, okay, at the higher level, right. So this common infection is difficult to treat, okay, it is difficult to treat. And which is the most common infection? As I said that it is mostly the viral infection, which is for the common cold, that will come into the various maxillary air sinus and other air sinus, paranasal air sinus, and if it become bacterial infection due to the bacteria, then pus will start collecting here, okay, into the maxillary air sinuses, and that's why difficult to treat. Okay, so this is the applied anatomy of the maxillary air sinus. Thus we have covered in this maxillary air sinus about its formation, the bony feature, I mean to say, about its different 5 walls, and then we have just learned about its relation of these 5 walls in relation to the nerves and vessels. Then we have learned also which are the opening, where is the opening located of maxillary air sinus, and in applied importance we have seen that the opening is at a higher level, hence difficult to treat. We have also learned about the arteries, vein, and the nerves of this maxillary air sinus. Okay, maxillary air sinus. Thank you very much for watching this short video on the maxillary air sinus.